Hey everybody, this is Andrew with Medic Made Easy, and today we're going to be talking about shock, also known as hypoperfusion. In this video, we're going to do a quick review of the 4 categories of shock: cardiogenic, obstructive, distributive, and hypovolemic. We're also going to talk through the progression from compensated to decompensated to irreversible shock. Now, in the shock triangle, you have 3 components that are the main contributors for all the different types of shock that we're going to cover: the pump, the pipes, and the fluid. Now, the pump is the heart, the pipes are your blood vessels, and fluid is all of the blood and blood components circulating around. The first category of shock we're going to talk about is cardiogenic shock, which is a pump problem. Literally, the heart itself is not pumping properly. Now, typically the case is after somebody has an MI, a heart attack. Now, their heart is no longer pumping nice and strongly, and as it starts pumping weaker and weaker because of that damaged tissue, the blood pressure starts dropping. You start exhibiting your classic signs and symptoms of shock. Now, the second category of shock is obstructive shock, which is a pump problem in a way. Unlike cardiogenic shock, where the pump itself was damaged, in obstructive shock, the pump itself is okay, just something is blocking it from working properly. Now, the analogy I like to use is with a car coming up to a construction scene. The engine in your car, the pump, is working just fine. You have all the fluid, plenty of gas in the car, and all the pipes, all your hoses, everything's connected properly. You should be able to go, but you have this construction site blocking you from moving. So again, in obstructive shock, the pump is okay, but something is blocking it from working properly. Now, the 2 main causes of obstructive shock are a tension pneumothorax or a cardiac tamponade. So in a tension pneumothorax, you have the hole in the ruptured lung that's releasing that air out into the pleural cavity with every breath that the patient takes. And as that air pressure builds and builds, then you get the classic textbook signs of a tension pneumothorax, which are going to be absent breath sounds on the affected side, and a much later sign is tracheal deviation, which is so much of that air pressure has built up and built up and built up that it's actually pushing the heart, pushing all that structure, pushing it all away to the side. And what you'll see is that trachea actually deviated away from the tension pneumothorax. The other progression with the tension pneumothorax is what they'll call hemodynamic compromise, which is as that pressure is building up, it's squeezing on the heart, squeezing on the aorta, squeezing on the vena cava, and really just restricting blood flow into the heart, which means the heart's not going to pump out much blood on the other side. So your blood pressure is going to start dropping and dropping, and it's all because of that pressure building up around the heart. Relieve the pressure, the patient's going to get a lot better. Now, the other cause of obstructive shock is cardiac tamponade, which, similar to tension pneumothorax, it's blocking the heart from working properly, but instead of air pressure building up in the thoracic cavity pushing on the heart, this is now fluid building up in the pericardial sac, and that pressure is what's squeezing down on the heart. It results in your classic Beck's triad, super critical to know for National Registry: jugular vein distension, narrowing pulse pressure, which is your systolic and diastolic numbers getting closer together and they're going to be going down, and muffled heart tones is your third variable, Beck's triad. The third category of shock that we're going to cover is distributive shock. Now, all of these shocks are pipe problems. Now, the problem is vasodilation. The pipes are too big to maintain a blood pressure capable of perfusing throughout the body. The analogy I like to use is if you think about hooking a coffee drinking straw up to your kitchen sink and the high pressure water that's going to be blasted out versus hooking a fire hose up to your kitchen sink, turning it on, and it's going to be a very low pressure of water coming out the other side. Now, the different types of distributive shock are anaphylactic, septic, neurogenic, and not listed here would be psychogenic as well. Now, anaphylactic shock is obviously triggered by some sort of allergen that's entered the body, results in the widespread release of histamine, which causes massive vasodilation throughout the body, in addition to hives or urticaria, itching, which is also known as pruritus, swelling, angioedema, which would be that swelling of the face and tongue. And a septic shock is an infection that has spread throughout the body. It's going to result in your classic infection signs and symptoms, fever, flushed skin, in addition to all of those toxins causing a widespread vasodilation, drop in your blood pressure. Neurogenic shock is a unique one. In all of your other types of shock, the heart is going to go tachycardic to try to compensate. Neurogenic is the one that, because of the trauma to the central nervous system, the heart is going to go bradycardic actually. In addition, most of your other shocks will have cool, pale, diaphoretic skin. Neurogenic, your skin's likely going to be warm, dry, maybe flushed. And obviously there's got to be some sort of trauma mechanism of injury for this patient. Now, psychogenic shock, which isn't listed, kind of similar to these in a way. It's a widespread vasodilation. Usually there's some sort of emotional trigger, psychological trigger, like people that see a needle and faint on the spot. In those situations, there's a brief vasodilation throughout the body, drops the blood pressure, drops the perfusion to the brain, makes the patient pass out. The last category of shock is hypovolemic shock, which is a fluid problem. You don't have enough fluid in your system. It's classified as either hemorrhagic or non-hemorrhagic. Hemorrhagic is just that there's some sort of major internal or external bleed, that you don't have enough blood in your system. Non-hemorrhagic, an example would be like severe massive dehydration. One of the other characteristics for both of the types of hypovolemic shock would be the presence of flat jugular veins, just one sign that you don't have enough fluid in the system. Now, wrapping it up, your body is actually really good at keeping itself alive in an emergency. So when it's able to vasoconstrict and go tachycardic and do all the things that it can do to maintain its blood pressure, that's when we say you're in compensated shock. Once, though, your body starts losing that battle and your blood pressure starts dropping, and once you become hypotensive, now we shift over and say that you're in decompensated shock because your body is losing those compensatory mechanisms. Once it's completely lost the battle, we shift over and say you're in irreversible shock. Now your body is not even trying to maintain a blood pressure anymore. Heart rate's dropping, respiratory efforts dropping, blood pressure's in the tanks, and you're really in bad shape at that point. Now, the classic shock signs and symptoms that we always talk about, one of the first ones you'll get, tachycardia, except for neurogenic shock. Remember, that's one of those unique ones. Tachypnea and hypotension. So again, with the concept of hypoperfusion, something somewhere in the body is not getting enough blood flow, not getting enough oxygen, sending that signal up to the brain. Brain says, I can deal with this. Let me breathe faster to get more oxygen in the system, and let me pump the heart faster to deliver that oxygen, all the while trying to vasoconstrict and do other things to maintain the blood pressure. Thank you for watching this video on shock, and if you have any comments or questions, please, I would love to hear from you. Don't forget to hit subscribe below, and don't forget to follow me on social media at Medic Made Easy. Thank you, and see you next time.